meetings, and he just had a Japanese prime minister, female. And I guess she got the most votes of any prime minister in history or something like that. So good for her. So she's committed to helping to keep our work on opening the Straits of Hormuz. And I've seen a proposal to have a pipeline, across the isthmus that's right there, the Strait of Hormuz. So trying to bypass, but man, Iran is like, hammering still. I don't know where these drones are coming from and these missiles, but they are like wreaking some serious havoc. They're hitting a lot of the oil industry of the Gulf states. I guess they put out a message. It's like, we're going to start hitting your facilities, so clear them out. So, and then shortly after that, they started, shooting missiles. It's like, we're going to come, we're going to kick you upside the head. There's nothing you can do about it, right? So Billy Jack. So we're seeing, Iran is not slowing down, and it's, Trump has said, kind of like Bush, it's like the war's over. Not a good thing to ever say until it's over, for sure, right? So not looking so good for the home team, but we'll see, because Trump may have something up his sleeves, and you never know. Today the stock market was down huge, then it recovered, then it was down again. The price of oil went up. It was like $119 in Brent crude, and then it collapsed. The West Texas intermediary WTI was up over 100, then it collapsed too. So it's something up somebody's sleeves, or are they manipulating the oil industry, keep the prices down? Who knows? But like I said, if you see the price of oil go down, you're going to see the price of the stock market go up. And sure enough, it did. It was down heavily. And then when oil turned around, the stock market turned around. So whatever's happening, manipulation-wise, they're doing a good job of it, because it doesn't look good out there, right? With Iran, still having teeth and sinking those teeth into everybody that's around them, it's not looking so good. So let's look at a little piece of this. Now, I think, because we're really hammering the deep state, that we're going to see some arrests very soon. James Comey, James Clapper, they're high on my list of people that are about to get arrested. And Comey was just recently subpoenaed in a sprawling Russiagate investigation. So, of course, Comey, former FBI director, has been subpoenaed in the Justice Department's Russiagate investigation. So in July, it was reported that former FBI Director James Comey and John Brennan were under FBI investigation over their involvement in Russiagate. So it looks like those two are going to be on the chopping block. And Juan has said that Brennan, because of his treasonous actions, he may go right to Guantanamo for his trial. He may not get any action in the compromised judicial system that we have here in America. So we'll see. All right. So, we've had, these other actors on the stage. Peter Strzok, and was fired from the FBI in 2018 for violating Bureau policies after he launched the Crossfire Hurricane Trump-Russia probe in July 2016. So he was a bad boy, and his little squeeze was a bad girl. So both of them, Lisa Page, so both were fired. Now, they were fired, but why didn't they go to jail? So they launched an investigation that caused a lot of problems and caused taxpayers and all kind of crazy stuff. Should be some consequences for that, right? And maybe they did suffer some consequences. I don't know, but I think they lost their top secret clearance and all that kind of stuff, and in that field, you can't do any work after you lose that. So I don't know. Maybe they hurt them in other ways. So let's look at all the stuff that's going on out there as far as like the Iran craziness. So there was a S-300, which is a surface-to-air missile. They believe it hit an F-35 over Iran. So we heard reports that missiles had struck an aircraft carrier, and then today they reported, oh, well, we had a fire on an aircraft carrier, and we're going to have to go to Crete and get it repaired. It was from inside one of the berthing areas, and 600 of our sailors don't have any place to sleep now, except on floors and so forth. I can't imagine. Ship life, as tough as it is, these guys have been at sea. Usually it's 6 months. It's coming up on a year, and they've already been extended to go to a year. So who knows? There's psychics said that they saw that aircraft carrier is going to get hit by missiles, and now we hear them saying they had to go into port in Crete and get it fixed. So were they hit by a missile? They're not gonna say, just like they're not gonna say that Netanyahu's in a coma or dead. So that's kind of the things that happen. So it's very suspect, right? That one day everybody's saying they get hit by a missile. The next day they say, oh, we had a fire on board our ship, and we're gonna have to go into port. Now the ship, these aircraft carriers cost up to $13 billion. And one of the reasons why they said it was going to cost so much is because damage control was being extended. It was going to be fantastic, but yet here we have a massive fire on an aircraft carrier that displaces 600. Now, normally these ships have like 5,000 sailors on board, so 600. Wow. Almost 1/5 of the berthing space just got taken away. So maybe one of those sailors set the fire so they could get some port time. That's a rumor that's going around too. So crazy stuff during these time frames, guys. All right, let's listen to a little bit of this.
Of the past 24 hours has originated. To be more precise, the rapid sequence of events began the previous evening, on March 18th, 2026, when leading global media outlets distributed footage and photographs capturing the aftermath of a coalition strike against one of Iran's largest gas fields, as well.
So this one of Iran's largest gas fields. Now, President Trump said that we did not do it. It was an Israeli strike, and it could have been an Israeli strike because the Iranians hit one of their gas fields. All the way out to Israel. Iran's still hammering Israel. Israel's going into Beirut, ground operations, displacing upwards of hundreds of thousands of people. So this war is spreading. It's getting more intense. Now, there's a Marine readiness group that's coming. I've said that they're going to have to put boots on the ground. President Trump says no. He's not going to put U.S. troop boots anywhere, right? And if I do put them somewhere, I'm not going to tell you guys, the press, of course. So that would be typical. They've got it planned, I believe, and so he's just telling them, no, we're not going to do that. Of course, they gotta, I think. So unless something is up their sleeve that I'm not aware of, it could, which is always possible, they're going to put boots on the ground, right? Because this thing is escalating. They're not getting control of the situation. It's starting to get worse, right? Even though the price of gas skyrocketed today and then it got hammered down, that's total manipulation to me, just like the price of silver and gold and everything else got hammered today. So is that natural? Is it normal? None of it's normal, but what part is being manipulated and what part's not?
Against the country's fuel and energy infrastructure facilities. Analysis of these objective control materials allows us to say with considerable confidence that the struck objects sustained damage of a critical nature. Almost immediately after the strike concluded, Iran's leadership issued a statement of fundamental importance. All analogous energy infrastructure facilities located on the territory of Persian Gulf states are henceforth declared legitimate military targets, meaning any countries that participate in strikes against Iran or whose territory is used to carry them out. Following this declaration, Iran published a series of maps marking zones subject to the immediate evacuation of civilian populations. Among the designated areas were the eastern part of Saudi Arabia, in the vicinity of Al-Jubail. Within Qatar, the industrial city of Ras Lafan in the north of the country, and the industrial city of Mesaid in the south, and the largest gas field in the south of the United Arab Emirates. Following the publication of these maps, the authorities of the Gulf states immediately began mass evacuations of the population from the designated zones, and within mere minutes or hours, Iran launched ballistic missile strikes against the countries of the region. The first objective...
All right, so about 4 or 5 different Gulf states, major oil and gas facilities got hit, right? That's not the end of the war, right? And I'm not dissing President Trump, but he's the one that said it. So he did say we're near, right? So near the end, but it doesn't seem like it to me, from my training perspective, right? So there's a lot of naysayers of President Trump. I don't agree with them, but I'm just looking at the what's going on. I'm like, it's not looking so good, right? So whatever you guys had planned, and they keep saying, Trump has said, if you do this, then we're going to hit you harder than you've ever been hit, and it's beyond belief, and blah 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 blah. But it doesn't seem to be having any impact. They up the hammer, and still drones and missiles come, guys. So not looking, like I said, not looking so good. There needs to be boots on the ground. That's the way it's always been throughout time. The Allied invasion of France and going across the straits and all that kind of stuff. It's you can bomb, you can bring the ships in, you can bombard the coastline, and you can bomb it. But as we saw, they bombed the hell out of the coastline. But as we saw, the Germans were dug in deep, and they hammered the landing crafts, and a lot of people lost their lives. So you can only do the bombing campaigns for so long until you have to put the boots on the ground and take over. We've done that over and over again. We did that in Iraq. You name a country throughout time, they can send the I don't know what they can catapult boulders into the city, but eventually they have to storm the walls and go in and take over. So it's going to be intense. Still 10 days until the Marines get there. I think they're around Singapore or someplace like that now. So they got to go up the Straits of Malacca and then come over into the Persian Gulf. So still 10 days away. Those ships don't move that fast, right? And they don't want to move that fast because they have to fuel them up, and then it will burn fuel and cost money and all that kind of stuff. Anyway. All right, so Larry, we got the discombobulator. Yeah, we better break that out. We better discombobulate these guys, and and then take over. I don't know. They're holding back, but we've seen this in the past where Stormin' Norman, he basically hammered the Iraqis under Saddam Hussein, and when they invaded Kuwait. And, he basically destroyed their military. And they stopped him from going into Baghdad. He could have just rolled right into Baghdad, cut the head off the snake, and then they would have to unconditional surrender at that point. But nope, they stopped him. He left the service not long after, being a hero. And he died not long after that. I remember he released his book. I read his book. I'm like, God, this guy's amazing. What happened? And then he died, right? So that's kind of the way these things work. He didn't know what he was up against. It was like Patton. Patton, I guess, didn't know what he was up against. He did the same thing. He rolled over the enemy, and he could have gone all the way to Moscow and destroyed all the enemy. And they're like, nope, hold it. And of course, we had the long drawn out war. It was the same thing with Iraq. We had a long drawn out war with them. So, what's going to happen this time? I think that it's going to be much better because President Trump seems to be destroying the deep state. So we'll have to continue to watch and see the the progression of this thing and how it breaks out. So like I said, Trump says no U.S. troops on ground. Japan joins U.S. allies in potential Hormuz Strait coalition. Potential Hormuz Strait coalition. Again, do they have something up their sleeves? If somebody's going to surrender? Maybe he's got some people in there that are like, we're going to surrender, so don't destroy everything. Everything's going to be good. I don't know. All right, so it's going to be very interesting to see what happens. Stock market futures are up because oil's down, but if oil spikes again, like tonight, if Iran, hits more targets and destroys more stuff, the price of fuel will spike, and then they'll come in and knock it down, and I don't know. So definitely some manipulations going on out there, I believe, guys. It doesn't seem like we're getting control of this. Now we're going to talk about Big Pharma. Going to have some guests on here in a few minutes. A doctor that's going to talk about is going to have a slide presentation of how Big Pharma basically has been, saying, different products, as we know, work good, but not so much, right? If you look at the evidence, it really doesn't play out. And we've seen a lot of this. If you look at, and I'll just show you, I mean, you can pull up on the internet. Here's the way I queried, the internet. Does Big Pharma lie about product outcomes? Yes. So this is, AI. Yes, there are claims. We have to say that, claims, because Big Pharma owns YouTube, right? And if you get out of line, they'll shut you down. So we'll have to play middle of the road and say, well, these are the claims, but they're claims and they may or may not be true. Now, a lot of times they'll have their doctors that do studies, or they'll do studies they pay for, right? And the outcomes seem to be okay. And then they have doctors that go through, their, programs. They're educated by them, and they're beholden to them because they pay them quite often a lot of money for promoting drugs. And so, we're not getting a real full picture, because anyone that goes against that, they'll cancel them. They'll if you're a doctor and you go against their system, they'll take away your license. And they're like, well, they're not a doctor, we don't recognize them. Well, they were a doctor, and they were speaking out, and you took it away from them. So this happens quite often. So yes, there are claims that pharmaceutical companies, often referred to as Big Pharma, intentionally misled patients about the efficacy of their products to maximize profits. This includes allegations of concealing negative outcomes and promoting drugs without full disclosing risk. Of course, when they promote a product on TV, it's often where they're like, you have that voice that talks like 1,000 words a minute, and these may have a problem with you, that kind of stuff. So we've had some very, very serious complications in the past with Big Pharma. A good one is OxyContin. Purdue, one of Big Pharma's big marketing campaigns and so forth, they got hammered. But that's not before they got hammered. They made billions of dollars, and they'd ruined the lives and killed many, many people. That's not arguable. That's fact. So definitely Big Pharma is something that needs to be watched and monitored. And we can make our claims, but because everything's controlled by them, we have to be very careful. But we can still come out and make our comments and talk about this stuff. And I'm going to have some guests that come on that are going to join us and actually do that.
Oh, hi.
All right, guys. Thanks for coming on. We've been on several times before talking about, the amazing product Skin Wisdom. But we're going to talk about a little bit more in depth this time. I know that you've got some really a great slide presentation. I think you're going to come out with.
Well, that's for later. I was going to talk a little bit about that.
We'll just talk on this one. Okay, fine.
So, I caught the last little bit there of what you're talking about. I thought it'd be interesting just to start off with why I got even interested in learning more about what Big Pharma was doing. So I don't even think you know that. So right out of grad school, I started a biotech company that was focused on developing oncology drugs using nanoparticles and things of that sort. Nice. And I remember sitting in my office one day early on, it's like 2004, and I was reading a press release from Genentech, which is a huge biotech company.
Yep.
And they had an antibody drug, and I believe it was Herceptin at the time, I think Herceptin. And it was for HER2 positive breast cancer. And I remember at this point, Genentech was 51% owned by La Roche. And I remember the results they got were good in the world of oncology. I think life expectancy doubled. And what I mean by that is it went from 3 months to 6 months. It wasn't like you were giving people years, right? And the spokesman for Roche said, "Oh, we're going to double the price because it worked better than we expected," and that floored me. And I remember that day because we had done deals with Novartis and Sanofi Aventis. We were doing pretty good sized deals with these companies. I was like, "There's not a chance we do a deal with Genentech if that's the way they think." I was for it. So that got me going. I was like, that fired me up because we're playing with people's lives at this point, right? We weren't dealing with somebody that had arthritis, even though those are bad indications. We're talking about people that are dying, they had life expectancies of 3, 6, 9 months. And we're going to double the price on them as if it wasn't already expensive. These are like $50,000 a month, medications that were in here. So I started really after I ran that company for 11 years and I stepped down as CEO and I started kind of looking into what was Big Pharma really do? Like, what are they doing? What are the games that are being played here? And you and I have kind of touched on this offline before, but I started looking at the different games that are being played, and I started putting together a little time. I was like, I would love to talk to Michael about this a little bit more and really kind of let people know what's happening. I'm not saying you have to do anything with the information, but I'm saying it's important people understand what's happening in the healthcare industry because these big pharma companies are responsible to bringing medication and healthcare to the general population. There's a big responsibility with that, and have taken advantage of that, in my opinion. They've gotten so big that they're able to do things that other the normal companies would never do in terms of their tactics. So the first thing I thought I'd talk about was kind of how they use patents to really maintain exclusivity for much longer than they're supposed to get. So you guys may know, you get a patent on a drug or anything, you get 20 years of exclusivity on that compound. So what pharma will do is they will make small little changes to the formulation. And I mean minor, like changing the crystallization, the type of crystals that they use, the different size, nothing that's going to really change the efficacy of the drug, but that gets them more and more patent life. What that means is that you can't get a generic drug developed, right? Because the patent still exists on the original drug itself. So this is called evergreening in terms of what pharma's doing.
Evergreen, yeah, that's interesting, Michael.
Evergreening.
We know that for other things.
So for example, Humira, which is Abilify's drug, It's probably had 250 patents filed on it. They've had exclusivity for well beyond the 20 years that they were supposed to, and they've really monopolized that drug, right? The other big example, and this is with Novartis, was Gleevec, right? Gleevec was a drug that was an oncology drug itself, and they were trying to repatent it using a different crystal structure than what was originally in the patents themselves. This actually went to the Indian Supreme Court, and the Indian Supreme Court ruled actually against Novartis for the first time, probably, saying that because there was no increase in efficacy, that there was no need for additional patent life extension and exclusivity for Novartis. Now, what that did was why it's so important is it took a drug that cost $2,200 a month to the patient down to $175 a month.
Wow.
Because generics are coming to the market now. And why that's important, the generics market is interesting because they can get to market quickly just by showing equivalency with the branded drug itself. And the way the economics typically work is for every generic that comes into the market for a drug, the drug price drops 10%. So the quicker you can get generics in, usually within a year or two, you get 5-6 different generics in, you're talking about a price now that's dropped in half or even more in some cases, which is a huge benefit to the patients themselves. So, the IP game is so big pharma's IP departments are probably larger than the patent office, the U.S. patent office itself. They probably have more lawyers there than the U.S. patent office can handle. The other tactic they do is there's pay for delay, and this is one that bothers me, where a big pharma will pay a generics manufacturer to not develop the generic, right? Almost like if you remember back in the 80s, there was something called green mail, where if you're about to be taken over as a company, you basically pay the people that are trying to take over your company to just walk away from the deal. This is what they do, pay to delay, and this happens quite a bit. And there was actually an FTC case against, I forget which big pharma it was, but basically showing that they were basically illegally paying other generics manufacturers to not develop generics of this drug so they could maintain their branded pricing, which is usually 10 times what the generic would actually be itself.
Wow.
So,
Trump has really pushed the generics, right?
Yeah, absolutely. And it's funny, who's really been big into it is Mark Cuban, actually. He has a company where they only sell generics, and they're very upfront. It's the cost of the generic plus 15%. That's it across all board, and it's online, and they deliver for you. It's actually a pretty impressive company that's put together with that. But yeah, generics are the other part of it is, with all up until very recently, Medicaid, and I'm sure couldn't negotiate as a group for all the pricing, or for the pricing of the drugs themselves, right? So if I'm in charge of Medicaid or Medicare, and I want to negotiate the price of insulin, I was barred by law up until 2 years ago to do collective bargaining for that. So every other country in the world, and this is where I get upset, every other country in the world is allowed to do that. So they get cheaper drug prices, right? So like insulin in the US will cost us $300 to $500 a month. In other countries, it's free or $70 a month, right?
Jesus.
Why that's a big problem is that it basically makes United States customers subsidize the R&D for the rest of the world, right? Because the pharma's making all of its money off of us. Then they're giving a subsidized price to the rest of the world. So the real money and innovation is coming from our dollars. And I find that just the fact we're paying more and we're giving the R&D to everybody else. It's crazy, right? I mean, you think about it from a logical standpoint, it's like, what are we doing here? That did recently change about 2 years ago, where they allowed collective bargaining on certain drugs to go forward. So that, and then the pharma's gotten to the size where they're so big, they're actually the largest spender on campaign contributions and lobbying efforts, ahead of the tobacco industry, ahead of the firearms industry, ahead of everyone. I think I'm just checking in 2022, they spent $370 million on different federal races and lobbying efforts. Between 1999 and 2018, they spent $4.7 billion.
Ooh.
So they're getting these politicians in office, and these politicians are beholden to those
and it goes beyond that, actually. Kind of to swerve a little bit into their influence is that there's always a revolving door at the FDA as well, where the regulators at the FDA aren't getting paid that much money, right? So they're working for the government, but then they leave and they're looking for their big paydays at pharma. And they know pharma's not going to give them their sweet little jobs if they're not ruling in their favor while they're at the FDA.
Oh,
Right? There's a lot of that stuff, right? And there's something called PDUFA, which is a way of accelerating your drug approval process that only big pharma can use because it costs a lot of money. But what you end up doing is giving you basically write a check to the FDA. They use that money to hire people to review your drug. So you're basically paying for your own approval. What do you think that actually does to the rate of approvals if you're paying for your own approval rates, basically, right? So, and I think the recent numbers I saw was up to 40% of the FDA's budgets coming through PDUFA fees now. So it's been completely taken over by the large pharma, and they're basically just funding their way through FDA process at this point, right? They're just writing a check and everything gets through.
Sounds like a very similar system that happens in the military. You have the admirals and the generals. They promote these missile packages or ships or so forth, and there's a waiting period, fortunately, which I don't think it makes much difference. For when you leave the military, it's like a year before you can work for an outside source that is directly in touch with what you just left. But these guys wait their year, and they're probably going on speaking tours or something, getting paid for those, and then they go and work for those companies. Oh, I have come in contact with those guys over the years when I was involved in doing military contracts and so forth. They are shady, and it sounds like the same system that the big pharma is doing.
If you think about it, a year is not that long to wait for a really fat 6 or 7 figure payout. Basically,
multi-million-dollar for
that's
I mean, these admirals and so forth, they make $100,000, which is like double what an average listing guy, senior listing guy does. But they get out and they're making millions. We have an admiral that spoke out against Trump, and I'm not going to name his name, but it was like this big deal that Amazon had, that they would give money to people that help the community. Right. So they gave him $50 million.
Wow.
And it's like, that was his payoff for speaking out against Trump. Okay. So.
Yeah. You see that a lot with the FDA, and you see that also at the patent office as well. A lot of these guys that are reviewing the patent. So I've been through that process. So the company I was at, we had 320 worldwide patents in 20 different families. So we were familiar with the process. So we went through it a lot, and it is rigorous. And they'll find any reason not to approve the patent at this point, right? They're overwhelmed. But if you know that you're looking for a job from, let's say Merck or whoever, and you're on their patent, you keep getting their applications, you're going to be a little bit more lenient and hopefully go on and work for them in a couple of years after that. I don't think the patent reviewers are making 6 figures, to be honest. So,
wow.
Yeah. So, I mean, there's other ways that this happens too. I mean, in the world that I was in, we were looking for getting acquired, things like that. So there are big pharmaceutical companies that use acquisition as the tool as well, right? So for the most part, unless you're very lucky, a small biotech cannot take a drug from preclinical development all the way through phase 1, phase 2, phase 3. It's just too expensive and it's too risky, even if they go public between phase 2 and phase 3. Right? I mean, that's the standard. Right? Usually you make a deal with a pharmaceutical company after phase 2 where you get some efficacy. That big deal pays for the phase 3, and there's usually an acquisition clause or something that happens after that. That's a pretty standard deal. So what ends up happening is that there's 2 different things that happen. One is big pharma will acquire a small biotech that's developing a drug that is in the same space that their blockbuster drug is on. So, for example, I'm Pfizer and I've got Lipitor. Then a small pharma comes in, or small biotech, and they develop a new drug, which would actually be better than Lipitor, but they buy the company and then they shelve it, right? So so now you're not only you're helping the bottom line of Pfizer, but you're also hurting the people in the healthcare system as well, because this new better drug isn't going to ever get to the market, and you're still going to have to pay the premium that you would for the drug before that, right? The other way to do it is what Valiant Pharmaceuticals did, and this was a notorious thing they used to do. Valiant would come in and buy drugs, smaller companies that had drugs in the market, and immediately upon acquisition, increase the price 500 to 1,000%.
Oh my God.
Immediately, because it was a drug that had its own monopoly. Either it was a drug that was for an orphan drug designation where it wasn't worthwhile for a big pharma to develop it because the markets were too small. And by small, I mean 20 million people. For them, that's a small market, right? Or it's or if it was, or if it was for pediatric or something like that, right? So these are people that are the most vulnerable, right? Because no one's developing drugs for small markets, because everyone wants $1 billion blockbusters. Or in the kids, you usually have pediatric indications typically have higher hurdles to go through, so they're more expensive to develop because you want the safety of the child takes precedence over the efficacy. And what happens is those are the ones that are the most vulnerable to all this stuff, and they're paying the price either with higher prices. There was I forget the name of him. He's notorious, a hedge fund guy, young guy. He went to jail because of what he did. He actually ended up buying a pharmaceutical company, and the drug was the only drug approved for, I think, pneumonia caused by HIV. And he literally was like a 40,000% increase in the drug went from like $50 a month to like $1,500 a month. It was something crazy, and a lot of people just couldn't afford it. Insurance wasn't covering it at those prices, so those guys ended up suffering with those type of tactics. So so between the patents or the IP methods and the acquisition methods, they really and the lobbying on top of that, they have full control from top to bottom. Which then brings up the last thing, which is that they control. People don't realize that if a pharmaceutical company, so a lot of people don't realize. So when you are under insurance and you pay a copay at the pharmacy of, let's say, $10, $20, $30, whatever your copay is, right? Once you tell the pharmacist, this is contractually obligated by the deals they have with the pharma companies. Once you tell the pharmacist you have insurance, he can no longer tell you what his real price is for the drug. And this is interesting. So let's say you have a $20 copay, but the pharmacist buys the drug for $5 and would sell it to you for $10 if you didn't have insurance, right? What ends up happening is you pay $20. The pharmacist gets his $10, but then they kick back $10 back to the pharma company. So they're actually getting paid $10 for your drug that you're getting. That blew my mind, actually, when I found out that's how that works. So you think you're getting a deal at only paying $20 for the drug, but you're actually paying the pharmaceutical company not only your premium, but that copay on top of it. 10 of it goes back to the pharmaceutical company.
Wow.
Yeah,
that's insane. And that's what they do for most of these drugs. We really don't have any recourse because they have, they're billion-dollar companies that have football field full of lawyers that'll come after you. It's tough to work around this stuff. But there's a lot of companies. There's one woman in here. She said, I was once on 18 different meds at one time prior to awakening. Weaned myself off of them. Took 4 to 5 years, and now she only uses natural supplements.
Right.
And her health has improved tremendously.
Yeah, and that's so. I don't know. My father passed away at 101, wow. And he was super healthy. Like when he was in his 80s, you would think he was in his 60s at the time. But then that's when they started, like he got an ear infection, right? So they gave him an antibiotic for that. Then there was this and that, and sort of diabetes. But they started giving him, their pills were crazy. And, we had to keep morning, noon, and evening pill packs. Also, and I can't tell you how fast the decline happened with all those drugs. There was a lot of over medication that's happening. And I agree with the audience that just wrote that, because I think I've mentioned this to you before, is, once I left that biotech that I started, my perspective on the whole healthcare industry changed, right? So I started believing, and kind of why I came to Wisdom was we have access to everything we need to heal our own bodies. We just got to make sure we do it properly, right? Whether it's preventative care, which by far is more important than any treatments afterwards. As long as you stay healthy, you eat right, you exercise, do all this stuff, that's going to benefit you way more than any of the medications that you're on. Now, I've spent a long time as well. I've been fighting with my blood sugar, and I was telling Jennifer, I've been working really hard to get my blood sugar down without getting on medication.
Right.
Turns out berberine, which is a natural, cheap alternative, was just as effective as metformin in clinical trials. But no one gets information unless you start really diving into things. It becomes the information is not readily available, and I think that's obviously done on purpose so that we can obfuscate, alternative medicines out there. And then, and I'm sure you know with the history of the Rockefeller family with the medical schools and how they've really pushed if you can't make it in the lab, it's not real medicine and all that stuff. So we lost a lot of our natural remedies that were out there. Now, obviously, there are times where traditional medicine is necessary. I'm just saying I think it's been taken way overboard with where we are now, and a lot of games are being played to make sure that for sure the American people are overpaying.
And metformin, I took that on recommendation of these guys are really into fitness and diet and so forth. So I took that for a while, and I didn't feel like it was really doing anything for me. But I have another friend that started using it because of this one guy that was following, and we did shows together. And he ended up getting like diabetes, something crazy. And he thought it was from metformin. So
and it messes up your gut a lot as well. Like, so the way that metformin works is that it doesn't allow the uptake of sugar in your GI tract, which then increases a lot of water that goes in there, which changes the whole biome that's out there, which has a whole other cascading effects as well. And the joke we had when I was at this company, I had a very strong board at the time. There were a lot of smart guys, and they would bring out, whatever, Vioxx or whatever the drug was at the time, and they pull out the package insert. And you just start reading off what the side effects are, by the way. A lot of times the side effects are infinitely worse than the indication that you're trying to treat. So again, I think a lot of this has to do with being informed and make sure, doing some research and it takes time and effort and things like that. But that's why I feel like I wanted to come on and really kind of address it, because it needs to be addressed and people need to understand what they need to learn.
So the side effects, they push vaccinations and so forth. The measles is like their biggest one they push these days. They've had 2 children, I guess, for like 15 years back. I saw this one presentation. 2 children have died from measles from the last 15 years, but over 128 have died from adverse effects. So which do you want to go with? So it's a tough. You got to do your research. You got to look at all the evidence. And I do berberine. I started doing berberine several years ago, so I've been on it for quite some time. I do see a difference with the berberine. So you have to do your own research, and sometimes you have to be the your own guinea pig. So that's because everybody's different,
Yeah, and I was telling Jennifer, I was like, so at Skin Wisdom, we're developing a bunch of new drugs cosmetics that we're talking about later. But I always test everything on myself first, because I know what's in there. I know they're all natural products. I know that I'm not going to cause any sort of real major issue. But they would never, if you're not willing to test it on yourself, I feel like you're lying to people out there, to be honest with you. So that's important. And now I think with all the available tools out there, whether different AIs that you like to use in the net, there's a lot of good ways to get that information. I will say those adverse events are difficult to find sometimes. They're not out in the open. The statistics on them are not. Yeah. So
remember the one you were talking about today where they changed the chart for the adverse events? That was
touching on, I wasn't going to read it, but touching on the Purdue Pharma. So I don't know. I'm very familiar with that company. I actually, when they went out of business, my company bought a lot of their equipment because the labs all got shut down and we needed lab equipment. But the people don't realize kind of how OxyContin actually got approved for what it actually got approved for. That drug was supposed to be non-addictive. That was the claim, was non-addictive. And the way that was shown was by changing the scales on the dose curves, right? So instead of showing that here's oxytocin, here's oxycontin and oxycodone, the curves would look like, really close, but they would put them on a log scale on the y-axis so that it would look like there was a much bigger difference, and it would be an order of magnitude or two that would show up that wasn't actually there. So, I was telling Jennifer, I was like, I wasn't going to talk about it, but there are a lot of tricks that can be played, and the reason why they work is because the people at the FDA, excuse me, were getting jobs at Purdue after they left. Flat, and that's been known. We've seen them. They basically were winking and nodding. They waited a little bit, and they got big paying jobs at Purdue Pharma after they left the FDA, after they got the drug approved with the special labeling that it got. So there's a lot of games that are being played. I think you're right. It's hard to find a way to solve some of these problems because of the deep pockets that big pharma has. But I think it's important for us. The more information we get out on it, the better chance we have of kind of tackling it. Right? Just sitting back and letting it happen is not really anything that I think is acceptable. I don't think you think it's acceptable.
So did you see that one series, Dope Sick, with Michael Keaton?
Yeah, that's
really accurate.
I think it's very accurate. I think that's exactly what happened. Actually, and I know for a fact the FDA part of it is 100% because there was actually investigations afterward about all that stuff.
Yeah.
There were criminal investigations. Unfortunately, the family had enough ties to Skankel, I forget the name of the family, but had enough ties where they didn't get criminally prosecuted. Wow. But they did have to pay, I think, $2 billion in fines, which who cares at that point? They already made tens of billions of dollars off the sale of the drug already anyway. So to me, a fine like that doesn't even make sense. I think the fine should exceed the revenue. That's what the fine should be. The fine should be, if you made $10 billion off this drug that you lied about, the fine should be $20 billion.
Yeah.
Or else there's no consequence. Otherwise, you made a few $1 billion for lying and you got away with it, to be honest with you. And, and what doesn't get factored into that, and I think it's shown in that movie, but is the fact that people got on these pain pills, right? For whatever garbage reason they got, because they said it wasn't addictive or what, and it was long-term pain management, whatever it is. Those people ran out of insurance or whatever. They ended up going to the streets. They ended up getting heroin or whatever they got. And so now think about, just from that one horrible decision that the FDA had based on fake data that everyone knew was fake once you looked at it. Mm-hmm. You had all these deaths that happened as a consequence of that. And to pay a few $1 billion fine is, to me, laughable for what was actually done to the American people.
Yeah, and then on top of that, because I've had people on that have, they got what's that spider thing that happens to your spine where you get, your nerves
are all messed up.
Yeah, so their spines are messed up, and that's from getting injections in the spine. And women, they give birth, get that as well. But it messes up their spines and their on medication for the rest of their lives after that. So a lot of those people, and we're talking millions in the U.S., they did have Oxycontin or some type of drug like that helped them, right. And they stayed within a parameter. They didn't get out of hand and so forth. Unfortunately, like some people did. So what they did is, because they got fined, all these people got fined, they came in and regulated, so that a lot of those people that were getting great results started to lose their drugs. And some of these people on my shows, and then you'd have doctors that would subscribe them, and they get in trouble because they're trying to help them, because that's what was one of the problems to begin with. Doctors were just giving it out like candy, and were using it for, selling it for drugs out on the street and all kind of crazy stuff. So that's one of the, problems with a lot of this stuff as well.
Yeah, I mean, look, we're in Florida down here, so this was the pill mill capital of the country. People would drive from Massachusetts down just to do the tour of Florida with the different pill mills. They have tried to put in different controls in, though I don't know how good they are, where the prescriptions go into a central database, and then you look for weird trends, and if someone keeps giving the same name, and like you can't do that anymore like they used to be able to do. One thing that I think was that they did that might have been a little bit overboard, like you mentioned, was you couldn't prescribe more than like a 3 or 5 day prescription of an opiate at a time for acute pain type of stuff, right? The problem comes in where people don't probably realize this because it was such a short period of time, but Purdue got approved to do so. Typically, it was a 15 or a 30 milligram pill. They got up to 160 milligram pill for 3 times a day. So that was an approved drug of an opiate at 160 milligrams per dose, which I just could not wrap. I mean, at that point, every receptor in your brain has gotten being hit 3-4 times by the opiate. So I think it goes back. I think that shows you more anything the amount of power they have to get something approved that was unnecessary. I mean, that's like you shouldn't even get that dose in the hospital, 160 milligrams, when the normal dose is 15 or 30 was considered a high dose at the time. Then they had the 80s and they had the 160s. So it's I think all of these things that we're talking about, even though we're kind of highlighting Purdue, it's just abuses that have happened, and they all do it, right? Look at Vioxx was another one, right? Vioxx was a drug that was for osteoarthritis or whatever it was, as a pain. It wasn't an opiate. It was a Merck drug at the time, I believe, and the reason why it was pulled off the market was because they lied about the data that was on. People were getting cardiovascular events and they were dying. You remember the whole thing with Vioxx was people were taking it and they were having like seizures and dying. There's a certain part. People don't realize Merck didn't get in trouble because of that part of it. They got in trouble with it because they lied, right? Pfizer had a competing drug. They just put a black label on it and it was allowed to continue to go forward. Again, even though we knew there was these significant adverse events that were happening. So again, you got to start questioning yourself, like, where are the checks and balances to the power of a large pharmaceutical company that wants to push a drug forward?
Yeah. So that had in the chat, someone told me what the name is: adhesive arachnoiditis. And then, really, really bad stuff. And then epidural. Cortisone epidural, women giving birth to babies, and then people with joint pains and all kind of crazy stuff, they get epidurals. They can make those bad, and then you're on a lifetime of pain, horrific pain. So I guess that's arachnoiditis is not something that's you laugh at all.
But then, go ahead. Sorry. No, I was gonna say, listen, I'm not trying to diminish the pain treatment area. There's a very valid for a lot of people. There's a point where someone's asked the question: is this being abused? Not the drug, but is the prescriptions being abused in terms of writing them? Are we taking advantage of the American people with what we're prescribing to them? Are we taking advantage of the American people and making them pay for everybody else in the world's drugs, basically subsidizing that? Are we taking advantage of the American people because we're not giving them alternatives that would reduce the price, whether it's through generics or competing drugs themselves? I think that's the point I'm trying to say, is that there's obviously in the opiate world, there are absolute uses for it, especially in the veteran care when people are coming home and they need, pain relief and things. What I'm saying is that being overly prescribed? One. Two, if for all the drugs out there, have we set up a system, not on purpose, but what has happened is the pharmaceutical companies have gotten so large that they can do pretty much whatever they want. And it's very similar to how when we got the banking crisis, right? You had these companies that were so large that if they went down, they would crash the world economy. So we couldn't allow it to happen. Are we getting to that point in the pharmaceutical world now where if we don't allow them to do whatever they want, we're not going to get drugs or new innovation, we should say, in the drug world, right? And, you know, people quote these numbers of $2 billion to create a drug. People don't really understand where that number comes. It doesn't cost $2 billion to make a drug. It probably costs closer to $800 million to make a drug. What they do is they amortize all the other drugs that didn't work into that number. They also take opportunity costs, which is hysterical because their opportunity is to develop drugs. So I don't know how you have another alternative opportunity than developing a drug that you're supposed to do. So all these other factors are put in, and they balloon that number up. And the reason why you would do that was to make everyone believe that it costs so much, so you should pay $50,000 a month for whatever life-saving drug you need there. And that's not the fact. It's not true.
Wow. And, you know, you get approved by the FDA, and then FDA seems to have their hand in, you know, control of you. And I know that you guys, you know, have not wanted to get FDA approval because of that. Tell us a little bit about that.
Yeah, so I mean, you can tell the story, but you know, for us, we've stayed in what we would consider the cosmetic space, and the reason why that's the case is because we didn't want to go through the FDA process going forward. One, we didn't think it was necessary because we could bring our stuff to market with the same benefits as we could otherwise. Eventually, we may go through it over-the-counter registration, which doesn't have to do with trials. We'll actually just submit a paperwork, and we're good to go for that. But I know in the past, before I came on, you want to tell the story a little bit about what?
Well, so the first thing that comes to mind, over and over again, when we were having great success with Skin Wisdom, one of them was with a large, I won't say the name because I shouldn't advertise for them, but a large company in Tampa that had 3 different large restaurant chains, some of them sort of Italian, you know. Anyway, we met with the head of that, who was a friend of our vice president. And I went in and he said he saw what it was doing. And I had been supplying the bottles to one of the local restaurants here. And all the cooks who were working over fires and stuff would spray it on, and it would stop the burn instantly. And I was working quietly with the National Cancer Institute trying to get it out too. Well, the CEO of this huge company said, we want it, and we want 12,000 bottles a month, but you have to be FDA approved. And I heard this over and over, Michael, so many times. So we go, okay, we'll get FDA approved. And so then a lot of miracles happened, and some people that were friends of mine happened to be working for J&J, I can say that. And it was my high school classmate. He was head of all silicone research for Mentor and then J&J. And he happened to be my classmate and friend. And he said, Jennifer, this is an incredible product. He'd been playing with it. He said, I'm going to get you a meeting with J&J. We did that. They were going to take it on. And then they laid off 4,000 people the next month and said, well, we're not going to fund it. But they all kept saying, you have to get approved. You have to get approved. We were hoping J&J would get it approved so we wouldn't have to pay the millions. Cool. So we have tried twice. I'll shorten this, but we've gone twice where we've manufactured product, got it ready to go to the FDA with my friend's paper, you know, the guy from J&J saying, this is incredible. You got to do it. We filled everything out correctly. Got the product made, and you have to wait 6 months to test it and 9 months. And all of a sudden they said, the product is falling apart. He was on our board at the time, and the person that had joined our board as we thought an expert for the FDA turned out to be probably an insider. And I won't say names, whatever, but I can still remember Habib and Dr. Bill Luria screaming, you know, this product doesn't fall apart. And I've got this here to show you, you know, this is 20 years. Wow. So, you know, we knew it didn't fall apart, but we were confused. So we sent it to a place to be tested, and they found out that the company I trusted and had been manufacturing for me for the past 10 years had switched, and they had added 250 times the amount of aloe into the product. They were manufacturing some pharmaceuticals. So I gather, I was so naive, I didn't realize the big world. I've learned the big world now, so I'm not naive anymore. But we transferred to another company in Florida and found out after 2 years, it took 2 more years to do that. I had to raise a lot of money, and we did it, and Habib was there. All of a sudden, they come back and say, your product is no good. It's dropping out. And I go, no, it's impossible. So this is a miracle. Dr. Bill was in his office and a woman said, my brother tests products like that. He's a professor over in Ohio at a university, and he'll do it for you because you're paying out of your pocket for free. So God took care of us. We sent it there, and he called immediately. He said they were actually washing the beakers with tap water, which you never use, not only pharmaceutical, with cosmetic, ever tap water. You always have purified water. And I had we'd gone into Estee Lauder. I'd seen companies with huge vats of purified water. They never manufactured.
Sure.
So we realized we'd been harmed twice, played with twice.
Wow.
I closed off my board and got rid of that person that was on the inside that had been sent from the first company. But then I started, of course, Michael, I was following you by that time. No, I started realizing this is a big deep state, whatever it is, but big bad people out there that don't want me to succeed. And I also was living in Florida. Over 80 doctors had been killed jogging, going to work, heart attacks, car accidents, 80 naturopathic doctors.
Right.
And I never forgot it. And I realized this is a war. This is a very serious thing. And I've been staying underground, Grandma Jen, that's all I am. That's all I am. But, I'll go back now to Habib, because at that point we regrouped, and now we're going forward again. Whether we get FDA approval or not, we might not, but we still have pressure. You've got to, if you want to help people that are sick, you have to get that approval. Well, it's crazy. Why? But anyway, go for it.
Yeah, I mean, we don't need the FDA approval at this point. We're staying in the cosmetic space.
Good.
We have to be careful of what we say in terms of the claims, but all the products have a lot of actives in them. We've spent a lot of time really developing these these cosmetics so that they have a therapeutic benefit, which, like I said, because there's aloe vera, there's proven ingredients in here that are natural, that have a significant effect. And that's kind of how we're going forward. I mean, we had mentioned on other podcasts that we're in the final stages of manufacturing of the lip balm that you tried out, that we sent you samples of. That should be coming out next week in terms of the first batches to make sure that everything's right and we're doing the full manufacturing. And then, we have probably about 8 more products that'll launch over the next, months or so. I'm sure in the next week or 2, you'll probably get a care package from us with a bunch of products. But, we're looking at, shave balms. We're really kind of looking at, and the way I think about it is the cosmetics that we're developing, whether they're serums for your skin and stuff like that, are so advanced from the standpoint of not only the silicone technology, but also the amount of ingredients in them. So different types of antioxidants that work different ways, that are staggered, different types of ingredients to repair the cells. So what we're trying to do, I was looking at it and I was like, these 2 serums here would replace 8 other, maybe 5 other products from other companies. So I think we ended up coming up with, we're trying to make skincare simpler for everybody. So we're going to give you all the benefits that you get from all these very, 5, 6 different expensive products and 2 products to make things much simpler and easier to take care of, but they have all the benefits of them. So hopefully in the next couple of months, you guys will get those released and we can talk about those products as well.
Oh, that's going to be great. So
I think it's a month.
Is February 16th,
right,
yes. 1 month later. A month and a week. Yeah.
Right. So that looks great there.
So that's just a month. Yeah. I mean, it's amazing.
That's incredible.
What you can see here is we're getting to the point where
that was today
almost completely healed. But I'll bet you any amount of money there will be no scar there from that significant burn. So the way it applied quickly, it healed properly, and you're actually going to not get a scar in that spot. I bet you if we took a picture of it in a week or 2, that you won't see a scar there.
Wow.
Amazing.
Yeah.
I had to text them and say, I need a new picture. So I got it just in time.
Perfect. And we've had a lot of people that have sent in, similar photos. But you're right. The sooner you get the Skin Wisdom on there, the better. And it really makes a huge difference. So that's why I say you should have Skin Wisdom. It should be in your med kit. Should be with you all the time.
Yeah, it stays with me.
Well, also, I just saw someone say they grow aloe vera plants, Janet DeMello. My mother raised me with aloe vera, and we have aloe in our spray. So just know that we're believers. But the spray is different, and it's very different than aloe vera, and it creates that barrier that stays on for 8 to 10 hours as you spray it on, because it's a silicone that adheres to the skin. So there's a difference. So we combined it. We've always had aloe in our product. Always.
The silicone itself, like Jennifer mentioned, acts as a semi-permeable barrier. But what that does is not only allows that oxygen and CO2 exchange and water not pooling, it actually keeps the actives like the aloe vera and the elanitol and all that stuff in contact with the wound for longer, so you get more benefit out of it, right? So I almost want it's not exactly that, but you can almost picture it as a liquid Band-Aid that's going over the skin itself, forming a layer, giving you the best chance to heal quickly.
Yeah, and we've all used it to great effect, and everyone that I've introduced it to, they absolutely love it. I've had great results from it. If I get a little or a big wound, whatever, I spray it on there, and it's healed within no time.
Right.
It's amazing. So anything that you have going on skin wise, and your skin is the biggest organ on your body. Yep. And you want to like give it the best stuff, and Skin Wisdom, there's no other better product out there.
A lot of the people that have been using it now have been using it preventatively, prophylactically. So that instead of getting cuts and stuff on their hand and waiting for them to get treated because they have dry skin, they've been spraying it on at night before they go to bed, and it's prevented that from even happening. And we saw that, I think, a long time ago. We talked about the Marine study that we did with 250 Marines that went out to the Mojave Desert for training. And when they applied it to their skin, their feet, their groins, and their armpits, that they were significantly reduced amount of blisters, chafing, and any of those type of stuff. So not only can it be used as a treatment, but again, kind of like we talked earlier, it's preventative as well.
Yeah, very good. So we still have a special sale going on till the end of the month, right?
Yeah, so we have 50% off using Jaco 2025, all lowercase, J, capital J, lowercase, everything else. 50% off and free shipping until the end of the month. And then, and I get it now because I think shipping costs are going to go through the roof where oil is these days. So I think next month we might see a little bump in that. So, yeah, free shipping, 50% off, Jaco 2025.
Jaco 2025. All right. Fantastic. And, that was last year's, but we keep it simple.
Keep it consistent for everybody.
Yeah. So, yeah, you guys are like, cutting edge, and we got more products coming out. Wow, that's going to be amazing. So I look forward to sharing those new products coming out. Thanks so much.
Yeah. Hopefully next time we're on, we'll have the lip balm will be out, and we can talk about that a little bit more.
Outstanding.
Lynn was sharing today because we were with her that her father had this allergy that his lips would blow up if he didn't put something on them. They get very dry. She has the same thing. And so, and I'm sure she'd be happy for me to share it here because she, but she said that she had chapstick in every room, like 4 or 5 in every room, because she had to constantly, every 15 minutes throughout her life, had to put it on. And her father had an incident when he was in the military where he went out for 3 weeks and forgot to bring it. He ended up in the hospital after 3 weeks, lips totally blown up, and he had to stay for days in the hospital from this disease. So she said what's different for her, because we obviously sent it to you guys and to Lynn to try it out. You explain what she said or how she said it.
So there was always this underlying anxiety that she had because of her lips. So you can imagine your lips are chapped and they're always in pain. Yeah. You're always going to have this underlying anxiety that, oh my God, what happens if I don't have my chapstick with me? Yeah. Because it lasted so much longer. And, it's not just a lip balm, right? So what we have in there is a lot of antioxidants, a lot of cellular repair drugs, so things that fix the actual lips themselves, not just an occlulant that blocks the moisture from being lost. Is that she got this real mental clarity and calmness that's come about her now because she doesn't have this constant anxiety going on in the back of her head because she doesn't have to worry about her lips, which I thought was really a nice unintended benefit to using it that we're really happy about.
Fabulous.
Well, patches. Patches, because that's why she came to you.
Yeah, it's great.
Yeah.
Dr. Ivy and Jen, thanks so much for especially those insights
Absolutely.
on the big pharma and stuff. That's great. So you're bypassing, because they wanted to, use your product, and it's great for, people with those angry cells and everything. And there's a lot of applications that can come about through the Skin Wisdom. And I think because you guys have basically worked through all of the craziness that's trying to take you down, you're going to get rewarded. I hope very greatly going forward.
Yeah.
No, I'm feeling very confident. We thank you and your audience for the support.
Yeah, thank you. We look forward to having you guys back on when the new products come out, and it's going to be soon. So get ready, guys. Yeehaw.
Spray on. Michael.